I don't know if you can name names, but besides Mayo, which is the epicenter of all of this, where else is this really resonating and taking hold if folks wanted to start to learn from any number of organizations?
Yeah. There turns out that there is a model of care that has evolved these minimally disruptive medicine ideas and principles sort of in the wild without our involvement and before our existence. And these are the HIV clinics that are funded by the Ryan White Act from Congress. These are clinics that are spread around the country that have federal funding to operate and have been very focused on helping patients with HIV take medicine that if they interrupt could create resistance, so viral resistance on the one hand, and complications and death. So adherence, sticking to the plan, was always very important in the care of patients with HIV. And those clinics very quickly recognized that, particularly as HIV became browner and poorer, that the patients that they were caring for didn't have the capacity, using now our language, didn't have the capacity to adhere to these complicated programs. They've gotten simpler now, but they were very complicated at the beginning. And so they developed processes of care that often include a pharmacist, a social worker, a secretary or a receptionist that also make calls the night before to ensure patients were coming to the appointments, and if they were not, problem solve with them as to why, send them taxis, help them with grocery shopping so that they would not have to put energy into the other things and not be able to have adequate nutrition, refill the prescription so that when the patients were leaving the consultation, they will leave with their next bag of medication. All these things evolved in the wild without any of the minimally disruptive medicine principles to care for these patients. So that's the example that I think is most accessible to people. At Hennepin County Medical Center in inner city Minneapolis, a safety net hospital, the primary care clinic, again, independent of these ideas, looked at the HIV clinic as a model for their complex patients. So there are a series of examples of minimally disruptive medicine arising as a response to a serious concern. What it has not happened is it has not spread to become the way in which we manage patients with chronic conditions in usual care. That's the role that I think we're playing now.